Assalamu alaikum, sabah al khair. I'd like to ask everybody in the room about how many of us did try or receive. It's okay, I will just go back. Yeah, thank you. Okay, did receive or were able to access any telemedicine services, whether consultation or prescription or anything. Anybody did try these services? Can see almost everybody. Okay, the question is, do you think that people who are delivering these services like physicians or nurses or whoever healthcare provider is trained to give this type of service, telemedicine? Are they all trained? Okay, let's see, okay? Without proper training, okay? But when I looked at the literature, almost very few tackled this point. So this is the gap that I'm going through. My name is Ebrahim, and before I start, I'd like to thank you for being here, and a big thank for my supervisor, Professor Francisco, and my local supervisor, of course, Dr. Isra, who is here to support me. I start shaking now, okay? So this is what I'm talking about, the assessment or assessing the competencies required by healthcare providers to practice telemedicine. Okay, by mic I can, right and left? Okay. So I'm gonna talk about these competencies and how they can help in sustainability in healthcare delivery. And I will talk about how the context is present in Bahrain, but very briefly. And I will explain more about the domains that I'm going to tackle in healthcare medicine. As well, I will talk a little bit about the theory and the design that I'm gonna use. Still, I didn't reach this stage. And of course, I will talk about the expected outcome. Of course, it will depend on the data that I will collect later and how it contribute to the practice in medicine. Okay, how the story start? Of course, with COVID, the close down, forced all the sectors to practice remotely, especially medicine. We have to implement telemedicine. It was not a choice, it was a fact that we have to deal with. But with time, we are good in telemedicine, but the practice that is given or not being enough to healthcare providers, this is the gap. We have improving telemedicine, but the competencies are not competing or working in parallel way with telemedicine. So this is the story of COVID and how we were forced to practice telemedicine. It was like a catalyst pushing the telemedicine forward, but the competencies are not competing or walking with this revolution or speed of the telemedicine. Telemedicine, briefly, is any type of medical services that we are or health professionals are giving through using the ICT, which is the computer or communication. So it can be directly like synchronous or asynchronous, which is briefly like direct or virtual calls, which can be at the same time, or any type of messages or different methods. We have the support nationally or in the national level since 2020. Okay, so this has been practiced. And mainly it is practiced as my colleague, the doctor here, in the primary healthcare, which is mainly the health centers. It is practiced with those who are having chronic illnesses like hypertension, diabetes, etc. The competencies, yeah, as I mentioned, we have gap. The competencies are not well developed to cope with the increasing or expanding use of the telemedicine. Okay, so the main aim of the research is to assess the telemedicine competencies among healthcare providers in Bahrain, and mainly I'm focusing on the government sector, which is more accessible for me, as I was working in the Ministry of Health a long time ago. And mainly I will focus on health centers, the primary healthcare, and the secondary, which is the government hospital, mainly Salmania. Okay, my population mainly will be physicians or doctors and nurses and other health care providers who are dealing with telemedicine. My intention is to bring the practice to the knowledge and the skills that all these healthcare providers have, to bring it in practice and make it more like applied to enhance the technology, or to enhance the ability of the technology that we have in telemedicine. The competencies that I will cover: technical, clinical, and communication mainly. So I'll go back to the technical competencies, which include using the platforms which we are already using, but we have some issues with technical problems which may appear while using the telemedicine. Of course, I have a couple of good IT technicians here, but physicians and nurses, they don't have this privilege all the time. So they have to have enough practice on the technical problem that is related to telemedicine. And a very important issue is documentation. How far we are good in documenting all these data that comes from telemedicine when we are dealing with patients, how we are recording all these data. The other part of the competencies is the clinical, or the clinicians. I don't focus only on doctors, but all the clinicians who are using telemedicine, are they able to conduct virtual assessment? Do we have the competencies or the abilities to do virtual assessment rather than the old days where we have the physical assessment face-to-face? And is there a good level of remote triage and decision-making? Is the patient who is on the other side of the camera is good enough, or does he need to come to the facilities to have further follow-up? Communication skills, of course, very important. Do we have skilled professionals that can have the empathy while dealing with patients remotely? And of course, the issue which is always tackled or always is a concern for the patients, the privacy. Do we have enough level to guarantee or maintain the confidentiality and the security of the data that we are dealing with? And of course, the professional conduct. Linking this with the sustainability, yes, sustainability is very important because the resources are getting less and less, and the demand is increasing day by day. So yes, telemedicine is good to maintain or to have a good level of sustainability. Can I have the health centers as an example? An average, maybe the physicians there are examining maybe 30, 40 cases or more in one day. So imagine if we can reduce this 40 visits, okay, to 3 or 4 visits per physician, okay? If we are talking about like 4 or 5 physicians in one health center, that is maybe 100 visits, which is less if we focus or enhance the telemedicine. Of course, it is cost reduction in all aspects. We are less consuming fuel, less using the facilities. The evidence or the literature shows that, yes, regionally and even globally, there is gap in this aspect. So I am trying to tackle this. The theory that I'm going to use is digital health ecosystem. This theory is more fit to my topic because it focuses or it visualizes telemedicine as an interaction between many components, including the patient, the technology, the healthcare providers, and the services. So the main focus is on the individuals or the healthcare providers. When you train them enough or they receive enough training, they will enhance the technology usage or utilization, which will reflect on the level of the services, and of course it will gain more trust and more use of the patient. My methodology will be descriptive cross-sectional design, which is more convenience and time, consuming less time, and it needs less resources. I will use two questionnaires, which is AKAS and AAMC. AKAS stands for Awareness, Knowledge, Attitude, and Skills. The AAMC is Association of American Medical Colleges. Of course, I will use the data analysis to describe the statistical findings. I'm expecting that there will be findings that tell me where is the strengths and the gaps in the competencies used or needed for the healthcare providers. And I think we will have some outcome to tell us where to put our recommendation, and we need to have structured telemedicine education and training for healthcare providers. This will enhance the patient trust and will enhance the use of telemedicine, because now some statistical data tell us that we are 50-50. Some patients, or almost half of the patients, are willing and some are reluctant. It will contribute to the knowledge, yes. It will add to the database, and it will give more context and specific evidence for Bahrain. And it is in line with the Vision 2030, which supports the sustainability and health system. Some limitations, of course, there are expected limitations, like I'm using self-reported data, which may have some bias because the patients or the participants, are not in face or direct contact with me, so they will fill their questionnaire by their own. And it is cross-sectional, which it will give a snapshot or only a short outcome or view about the concept. Yeah, for future research, I do recommend longitudinal studies to have more outcome of this. In conclusion, telemedicine requires multidimensional competencies that will enhance or improve the level of technology or usage of technology in telemedicine. Again, these are the references. Once more, I'd like to thank you for being here. I'd like to thank Dr. Noor and my supervisors, Dr. Isra, and the floor is yours now.